HSAs, FSAs, and HRAs. Imagine this. You've just started a new job. Along with the excitement of a fresh start comes the avalanche of paperwork, including information on benefits like health insurance. Among these documents, you might encounter terms like HSA, FSA, or HRA. Or maybe you saw the HSA designation on a Connect Marketplace plan. If you're like many people, you might find yourself wondering, what on earth are these programs and how will they benefit me? We're here to explain what these are and how they can work to your advantage. Let's start with HSA, which stands for Health Savings Account. An HSA is exactly what it sounds like, a savings account that allows you to set aside money for qualified medical expenses. Contributions to your HSA are tax-deductible, which means that you don't pay taxes on the money you put into an HSA account. Plus, the money in your HSA grows tax-free, and when you use it for qualified medical expenses, withdrawals are also tax-free. There are specific rules that apply to HSAs. In order to open and contribute to an HSA, your health insurance plan must usually be a high-deductible health plan, also known as an HDHP. An exception to this is that as of January 2026, all bronze tier and catastrophic plans available on the marketplace are eligible for HSAs. Some silver, gold, and platinum marketplace plans may also qualify if they meet HDHP requirements and are labeled as HSA eligible. HDHPs typically have lower premiums, but higher out-of-pocket costs than non-HDHP health insurance plans. If you have an employer-sponsored health plan with an HSA, you, your employer, or both can contribute to your HSA. However, the total contributions from both you and your employer must stay within an annual limit determined by the IRS. For 2026, for an individual, that amount is $4,400. So, the most that an individual can contribute to an HSA for 2026 is $4,400. If your policy covers you and your spouse, you and your children, or you, your spouse, and your children, known as a family policy, you can contribute up to $8,750 to your HSA in 2026. If you are over age 55, you can contribute an additional $1,000. What are the benefits of having an HSA? First and foremost, the tax advantages make it a powerful tool for saving money while managing your healthcare costs. Another benefit is that if you have put this money into a special account, it will be there when you need it for medical expenses. Flexible spending accounts, or FSAs, also offer tax-free money to use for healthcare expenses. Similar to an HSA, both the employer and the employee can contribute pre-tax money to an FSA to pay for qualified medical expenses. If an FSA is offered, an employee can contribute up to $3,400 to their FSA through payroll deductions in 2026. The employer may, but is not required to, contribute to an employee's FSA. A key distinction between HSAs and FSAs is the use it or lose it rule. Generally, any funds remaining in an FSA at the end of the plan year are forfeited. However, if your employer allows it, up to $680 can be rolled over from 2026 to 2027. Note that the maximum allowable contribution amounts for HSAs and FSAs typically change from year to year, as does the FSA rollover limit. Finally, let's look at Health Reimbursement Accounts, or HRAs. Like FSAs, HRAs only exist as an employer-sponsored and owned benefit designed to help employees cover medical expenses, but they are structured differently. HRAs are entirely funded and owned by the employer. Employees can then use these funds to cover eligible medical expenses. A key difference between HRAs, FSAs, and HSAs is that HRAs can be used to pay for health insurance premiums, while FSAs and HSAs cannot. Employers and government rules determine what costs can be covered by HRAs. The IRS sets the guidelines for what expenses can be paid for with FSAs and HSAs. These qualified expenses include a wide range of medical, dental, and vision services and products for you, your spouse, and your dependents. These qualified expenses include copays, coinsurance amounts, deductibles, prescription medications, and eyeglasses or contact lenses, as well as many over-the-counter items such as pain relievers, bandages, pregnancy tests, menstrual products, and more. You can find more information on qualified medical expenses on the IRS website. As we wrap up our look at health savings accounts, HSAs, flexible spending accounts, FSAs, and health reimbursement accounts, HRAs, we can see that these programs offer valuable options for managing healthcare expenses. Each one has its unique features and may be available under different circumstances. Whether you're considering opening an HSA, participating in an FSA, or utilizing an HRA through your employer, remember to explore your options carefully, consult with your financial advisors if desired, and make informed decisions that align with your healthcare needs and financial goals.